Okay, good evening ulit. So, continuation natin sa tongue diagnosis made easy. Part 4, yung pale tongue and narrow tongue. So, ang symptoms niya is merong slight swollen tongue, pale, narrow tongue bodies, may indicate deficiency of blood and improper circulation of liver qi. In such cases, the narrow tongue will look slightly contracted. This type of tongue arises from spleen qi deficiency that lacks strength to circulate qi and produce blood. The consequence can be insufficient supply of qi and blood to the channels, collaterals, muscles, leading to weakness and pain in the extremity. So yan po yung pale and narrow tongue. In rare cases, only one side of tongue is contracted. So pwede rin one side lang yung nag-contract or draw in. This change suggests liver qi constraint and lack of liver blood flow since the sides of the tongue reflect the circulation of liver and gallbladder qi. Pain or sense of weakness along liver or gallbladder channel can be manifestation of this pathology. So sa liver and gallbladder yung pathology. This is a common tongue sign and particularly in women who suffer from various breast diseases. So pwede po sa mga babae. The contracted side of the tongue does not always correspond to the side of the affected breast. So hindi ibig sabihin same side po ng breast problem, pero this coincides mostly to women who might be having a breast problem or breast disease. So, ito po yung first case natin, yung female, 37 years old. Yung tongue description, merong siyang slight pale, swollen yung tongue with teeth marks, narrow on both sides, and drawn in. So, yung symptoms, pain in the left thigh and shoulder, migraines with sensitivity to light during menstruation. Sa Western diagnosis, organized hematoma in the thigh. So, meron siyang hematoma. Sa background to disease, ang patient natin dito is overworked with side effect of contraceptive pill daw. Okay? So, sa TSM diagnosis, we have the spleen qi deficiency, liver blood deficiency, and liver qi constraint, possibly blood stasis. The next case is a female, 28 years old. Ang tongue description niya is slightly pale, swollen siya, drawn in on both sides. So, yung sides kung nakikita niyo may papasok po na konti. And yung symptoms naman, meron siyang pain in the right arm and shoulder, may tingling and numbness of the thumb, may muscular tension, ringing noise in the right ear. Sa Western diagnosis, meron siyang brachial plexus neuropathy. Okay? So, mag-check natin sa tongue. And yung background ng disease, nagkaroon siya ng whiplash. Accident po ito na push po yung head backward. And sa TSM diagnosis, spleen qi deficiency, meron siyang liver blood deficiency, meron siyang lack of nourishment of the sinews and tendons due to qi and blood deficiency. So next case is the female 38 years old. Yung tongue description niya is pale. There is a strongly drawn in, especially on the left side. Kung makikita niyo po dito sa isang side, papasok siya ng konti. Yung symptoms, meron siyang weight loss, fatigue, swollen axillary lymph nodes, meron siyang pain under the right hypochondrium. So, di ba yung right side natin, yung right hypochondrium, nandito yung liver. Sa Western diagnosis, there is a bilateral breast cancer na may metastasis din dun sa my liver. Yung background to disease, there is a suppressed hunger. So, kailangan natin ito itanong sa pasyente kung meron siyang mga emotional na problem, and overwork din po siya. Sa TSM diagnosis, there is a spleen chi deficiency or blood deficiency. Meron siyang liver chi constraint and liver blood stasis. Pero yung patient dito dies 1 year after this. So, thank you po for listening.
Any comments? Thank you very much, Sir Dino. So, for those who have been listening, ang topic ngayon is pale and narrow tongues. So, obviously, if you see that kind of tongue, since merong konting contraction doon sa middle area, sa sides, then you would be eliciting from the patient symptoms that affect the liver and gallbladder channels. And these are very indicative of the fact na we should not ignore this. Kasi minsan, the patient could already be in pain. And if you do not know how to elicit this symptom, then probably walang gagawin. No? So I hope everybody realizes how important this study group is, because for us, the best for us, if you know how to look at the tongue, you will be, you will be expected to have a very good diagnosis and subsequent management of the patient. No? So I implore everyone to be more attentive while attending.
Promise, pa-practice.
Oo, kasi
Promise, pa-practicing ko hindi.
if you're really serious about your craft, then you would not allow any distractions to affect your studies. No?
Yes.
At saka try to be polite by muting yourself. Okay, so any questions po?
Kasi, Doc, wala naman ako itatanong. Pero, papracticing ko yan. Nakita ko kasi yung sinabi ni Sir Dino na even yung shape niya, yung gilid, lahat pinakinggan ko.
Wow. Sige.
Sige, papracticing ko yan sa promise.
Okay, sige po. Good luck. Any other question? Can we hear any comment from si Sir Jevan? Ano yung tanong nyo kanina, Sir Jevan? I hope your signal is now much better. Ay, hirap pa rin. Did you post your... Parang parang lumalala yung aking kidney deficiency. Can you write your question na lang? Sige po. Wait lang. Okay, may mga tanong pala dito. Sir Dino, we have a comment from Dr. Ryan Baldomero. Very well structured and delivered yung presentation. O, di ba? Congratulations. Especially with the unpredictable weather and the interplay of the human body. Yeah, great job. O, di ba? Congratulations. Yes. So, if you go to Alaska or probably punta ka ng isang country na winter pa, kahit malakas yung ating upright chi or yung ating immune system, you will still get sick, no? So it's basically comparing your upright chi with the pathogenic factor. Okay? So yun. Sometimes kahit mild lang yung pathogenic factor, but since you have a very, very weak immune system or super yung deficiency mo, may young deficiency ka, then definitely you will be affected. But again, I think what we discussed today was the opposite of the past few days, diba? Like if you remember, yung tongue na diniscuss ni Sir Dino was pale and swollen, right? And this time we have pale and thin. Yun. But the tongue is red. And hindi pala pale and thin. Pale and thin, red and yeah. Yung asawa, pag inuubo, tinatapalan ko lang po ng buyo and gumagaling. Ay, wow. Congratulations. Pero Ma'am Michelle, tingnan niyo po yung tongue, no? Kung po pwede i-share niyo po sa Monday. Or i-message niyo ako. Aralin natin yung tongue niya. Nawawala talaga, pero who knows, pumasok na siya. Mahirap po talaga ang tongue diagnosis pag hindi tayo nag-practice. Okay? Yes. Do we have other questions? Ano po dapat yung itatanong? Ayun ba yung ubo ni Sir? Mag-asawa kayo ni Ma'am, pareho kasing apelyido, Sir Jevan and Ma'am Michelle. Yeah.
Yes,
So,
Doc, mag-asawa po kami.
Siyempre na obvious naman. Ikaw ba yung may okay, wag na lang natin i-mention dito. I remember now, yeah. Dapat pala ikaw yung...
Yes, Doc, ako po yun.
dapat ikaw yung inano. Yeah, I remember your tongue, but we're not supposed to divulge it here. Sige. I'll
Yes,
see you
Doc,
on Saturday.
kaya po sumali. Kaya po
Opo.
sumali yung asawa ko kasi gusto niya po akong tulungan sa ATP ko kasi ako lang po palagi yung nanggagamot sa amin tapos wala naman pong gumagamot sa akin.
Oo. Ngayon kasi sa panahon ngayon, Ma'am Michelle, kailangan marunong kang tulungan ng sarili mo. Pag hindi ka marunong tumulong, mauubos talaga yung ating budget, no? Yeah, from Sir Leo, yung last topic. Yeah, thank you po, Sir Leo, for reminding. Pale and swollen. Ngayon naman, pale and thin. Okay. What we wouldn't like to happen is, yung thin tongue mo naging red na, no? So pale, it's still, wala pa siyang heat. Thank you. So, you see? So, marami daw natutunan si Sir Leo, Sir Dino, di ba? Sinishare lang ni Sir Dino yung kanyang mastery of the tongue. Is there anyone else who would like to ask? So, Ma'am Criselda, we expect you to be better already. Kunan mo ng picture lahat ng mga tongue at tongue ng mga kasama nyo dyan. So, thank you daw sa lesson ngayon, sabi ni Ma'am Annalyn. Very comprehensive. Yeah, I hope you're able to remember, you can recall, okay, summarize lang natin ha, yung four levels at saka yung 6 stages. Mauna po yung 6 stages. And this was used to describe the progression of wind-cold invasion. Samantala yung 4 levels, wind heat. So I hope you can study the notes, and obviously we should focus on we should focus on identifying yung defensive chi level pa lang. At saka pag nasa chi level na po kasi, mainit na, meron ng bakbakan, di ba? Yon. Nandun na yung 4 bigs. But anyway, on Monday, Sir Dino will still talk more about it. I think we still have 2 or 3 sessions pa. I hope everybody learns a lot here. Paulit-ulit lang talaga, 'di ba? Kahit ano, kasi we've tried this before. We just took this up like one case pero hindi related na yung iba. Lalong nako-confuse. Yeah, we have to expel po the wind. Yes. And we already gave you the points. Okay? So paki-check na lang po sa notes. Biglang delete agad. Okay. Maraming salamat po sa lahat. Sir Dino, do you want to add something?
May share ako, Doc.
Yes, yeah, Ma'am Ma'am Mildred. Yeah, we would be excited to hear your sharing. Sige po.
Narinig ko po kasi ng buyo. Sa Bicol din po, buyo din po yung gamot na yun eh. Sa karanasan po namin yung paggamit nun, napakagaling po niya exteriorize na mga pathogens. Kaya yung tinapal po sa likod, parang nahihila po niya yung wind heat or wind cold. Nakakatulong po yung herbal na yun. Thank you po.
Yeah, thank you po. Sana po aralin ninyo yung paano yung mechanism no na. Wala po kasi tayong herbology dito.
Oo nga po eh. Pero matagal na pong ginagamit, Doc, yan ng mga ng mga albularyo, sa mga baryo.
Okay. So kailangan yung wag niyo tawanan yung albularyo. Dapat you have to find out bakit siya effective. Malay mo, 'di ba?
Kahit po yung mga nauuntog, Doc, pag natapalan,
Wala.
mabilis. Right, opo.
Okay. So siguro niya, ini-eliminate niya yung wind.
Opo.
Mm-hmm.
Kaya yung gumagaling po yung may mga ubo na tinatapalan. Wind heat or wind cold po gamitin.
So Ma'am Michelle is raising her hand.
Ako din po, yung sa anak at asawa ko po, yung dahon ng buyo at saka dahon ng shoot ng banana leaf.
Okay.
Very effective po. Kahit isang beses ko lang pong tinatapalan, gumagaling na po siya sa susunod na mga araw.
Diba? Pero hindi mo alam ba ano nag-work.
Parang po yun, sinisip-sip niya po yung mga lamig.
Okay. Yung wind cold. You don't say lamig.
Yes po.
So Okay, wind cold. Yeah, from Ma'am Gemma Chundis. Thank you sa tiyaga daw. Actually, I'm doing this because I want to study. So, pag ako lang kasi isa mag-aral, mukhang boring. Manonood na lang ako ng movie. O magbabasa ng libro. Kaya, join me in this journey because I believe that it is only through our concerted efforts na ma-achieve natin yung success, no? Kasi we want to show the whole community that pag sa LAM ka nag-train, medyo mas malalim yung natutunan mo, di ba? I hope everybody will agree to that. It's a lot of effort actually, but I think you should always start somewhere. And we should never pretend to have known everything. Kaya, tsaga-tsaga lang tayo.
Study.
Yeah, and because when you're in front of the patient, sometimes you don't know what to do. But pag next time around, yun pala dapat ko gagawin. So alam na. Okay, so hindi na natin paaabutin na pumasok. Kasi especially sa Monday, we will only be taking up the chi level and defensive chi and the chi level. Hindi na po aabot doon sa ying chi or nutritive chi level and the blood level. Kasi usually hindi naman pupunta yan ng clinic no? Diretso na po yan sa hospital kasi nagdidelirio na, nagko-convulsion na. Okay, so
Doc?
yeah.
Doc? Hanggang kailan po ba yung Zoom natin?
Actually, Ma'am Michelle, hindi ko alam kung kailan tayo matatapos. For your information, this is already our 3rd year. No, we started in May 18, 2020, at the height of the pandemic. So, ang goal
Ah,
talaga ng founder ng lab is to educate us para mag-review kasi naka-lockdown. So ngayon, yun. Kung sa bagay, pandemic pa man din, hindi pa naman natatapos. So hindi pa kami tapos. And through the Zoom, we were able to hone our skills. No? Paulit-ulit lang talaga hanggang sa nakatulong talaga sa clinic. No? Kasi iba talaga po kung iba yung mararamdaman ng pasyente na marunong ka. No, ramdam nila yan. Especially if you know how to, to talk to them. You only ask questions that are relevant because of what you see, no? Kaya yun. So for those who want to join us, kahit ano lang, we have these special sessions every Friday night. You can join our CAA group. They will now be studying Module 2, diagnostics. It's actually my favorite part of the program because for me, if you are not a good diagnostician, then you have no right to perform. Medyo masasayang kasi yung pera ng client mo, no? And I think this is the thing that will set us apart from the others. Ako kasi, if you do not look at the tongue or feel the pulse or do abdominal palpation, ano pa ba? Or ask very, very intelligent questions based on what you see or feel or hear, or then you have no you don't belong to our group. So yun. Kaya we call our group as the elite group. Hopefully we'll become elites. Effort lang po yan. Anyway, we just meet 3 times a week, Mondays, Tuesdays, and Wednesdays, no? Except for those days when Dr. Webb has a lecture, a big lecture. Okay, it's the same link po. It's the same link, no? It's the same link. When I'm excited about a program, I put all my heart and soul to it. And kaya minsan nasasaktan ako when people don't really give it much importance. We will never stop the Zoom training. Free na nga no? Ang problem lang, some people don't ewan ko lang kung ganun na ba sila kagaling, but I doubt. Anyway, so yes, please support our programs and we hope to give you the best only LAM can offer. Okay? So maraming salamat po. Yeah, we will never stop this. Sige. Thank you, thank you. And also, I'm excited about the group of Sir Mahin, no? Kasi si Dr. Ryan also is preparing his presentation for the heart, no? And I saw his presentation. It was very beautiful, as in. Okay? It's about the heart. Nawala na siya kasi may estudyante daw na magpapa-certify. But anyway, yun. So, thank you very much, everyone. Thank you po. Ma'am Betty, thank you rin. Si Ma'am Betty talagang hindi po ito napapagod. Never ending. She never stops learning. Sa Pulse. Okay, anyway, makikita naman tayo sa Saturday. Sige, I'll teach you. I hope we'll have the time, no? After the patient on Saturday. Thank you so much, everyone. And thank you, Sir Dino. Sana, and I hope he's enjoying his... Okay, thank you po sa lahat. Thank you, everyone.
Thank you,
Good
Doc.
night po. God bless. Thank you.
Good night, Doc. Good night, Sir Dino. Thank you.
Ano po?
Thank you, Doc. Thank you.
Thank you, Doc. Thank you,
Yeah,
Sir
thank you po.
Dino.
Bye-bye.